It's a disease that has its severity, but the great news is that nowadays we have a lot of different treatments. And as I mentioned before, nothing is a silver bullet, but when you combine all the modalities we have, then you're starting to really make an impact.
Welcome to the LearnSkin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health, Inc. Let's get to the good stuff.
Hey, Raja, how are you today?
Hey, Hadar, you know what? It's just you and me, my friend, so you've got to be the expert.
What? No. Wait, you will be the expert. How about that?
No. Thank you. You'll be the expert.
All right, let's do it. You know what? I think today we want to talk about a disease that's very near and dear to my heart and your heart. I know you definitely see a lot of patients, and this is a medical condition called Hidradenitis suppurativa, which we'll discuss today under the term HS, because frankly, this is how most people know it anyways, but it does stand for Hidradenitis suppurativa, and it's a disease, my gosh, probably right now in dermatology.
The most devastating, wouldn't you say? One of, I mean, if it's not the most devastating, it's got to be top 2, top 3.
Yeah, no, absolutely. And, if you get a melanoma, God forbid, that has a risk of killing you. But HS, kills you slowly. And there's definitely data showing that there's increased rates of suicide, definitely depression. And so it's a different way of killing you, right, from the inside. So let's talk about that. Should we?
I agree. And in fact, as we're getting into this, Hadar, I think you know a little bit about the HS Foundation. So do you mind just telling us a little bit about what you do with HS? Maybe I can tell you what I do with HS just to kick this off, and let's jump into things.
Yeah, thank you for bringing it up. And it's a great opportunity to plug the foundation, which is right now the largest organization. It's a nonprofit organization actually in the world that's trying to really care for people with HS. I mean, that's our mission. Our mission is a world where people don't suffer from HS anymore. It's kind of a high task, but we're certainly making a lot of progress. In the last couple of years have been really, really tremendous progress. So people can Google the HS Foundation and go to the website. And for people who are clinicians, you'll find a lot of great resources there. There's a lot of papers actually that the foundation is paying to put there for open access, like the North American guidelines. So if you're not sure what to do with a patient that comes to your clinic, or you want to see what the standard of care is, sort of speak, then you can definitely get it there. One of the most useful resource there is a prior authorization template. So if you're trying to get, let's say, a biologic, any biologic, if you look on the website, you can find just kind of Word document. You just one click, download it, and boom, you have a letter ready to go to the insurance with the latest citations and all that good stuff. You can just edit a little bit, sign it, and boom, it's on its way. But if you're a patient, oh my gosh, there's a ton of stuff out there. And I think it'll be really, really useful for patients to see. For example, you can just one click and you can find an HS practitioner in your neck of the woods. So, any dermatologist should be able to handle this disease, but some people really want to see patients with HS, and they've made the effort of listing themselves with their kind of sub-expertise, if you will, within the disease. Do they do surgery? Do they do lasers? All kinds of stuff like that. So that's another resource. And there's a ton more that is happening. Even if you're a researcher, believe it or not, you can actually get some money to do research over there. So the foundation is doing a lot of work, a group of dedicated people who really, really dedicated a lot of time. We have a new president now, and the board of directors is really, really passionate about going to the next level. And there's even a meeting that happens and all kinds of good stuff. So the HS Foundation is the website. Just go there.
Hadar, I think it's about time that we've been having more conversations around HS. What a devastating disease in terms of just its clinical presentation. Maybe you can just give us a quick snapshot on why it's so devastating. But, I have a question that if you don't mind incorporating into your answer, why are we talking so much about HS now? Is this something that didn't exist before, or are we finally paying attention?
Oh, I think dermatologists know about this disease for hundreds of years. But the main reason I think it came into focus is the idea that it is an inflammatory condition and put a target there for us to treat. And so, you got to give credit to adalimumab, currently the only FDA-approved drug right now, and hopefully there'll be more in the very near future. But that really brought into focus. If you plot, and when I give a lecture, I have this slide where I plot the publication number over time, and you can see around 2015,
Yeah, no
2016,
kidding.
when it was approved, boom, you see hundreds of publications. And so that's kind of the short answer. I think the identification of inflammatory targets in HS really made this a disease that now we can modify. And it's true, we don't have a cure yet. I wish we had, but definitely we can make a big difference. And so the disease itself, for those of you who haven't seen it, is really presenting with these abscesses, nodules that develop into tunnels that keep draining fluid, pus. They're very painful, can be itchy, and they occur in skin folds, typically in the armpits and the groin area, the buttock. For women and under the breast, that's a very common area as well. There's other atypical locations, but these are the common ones. And you can imagine the effect this would have on a person's life, right? So the prevalence of the disease is really peaking around late puberty, early adulthood, so in your 20s and 30s. And so this is the time where, a person like you and I is really trying to take off with their life, whatever you're into, right? So if you're in college, if you just got your first job, if you just got your first date, right? So you can imagine that you sit in a board meeting and all of a sudden, oops, there's a leak. Oops, there's a pain, right? And so if you're sitting in a college class, in a lecture, if you're sitting on your first job interview, you can imagine also if you're trying to have intimacy with anybody, it's very difficult. Even though, I got to tell you, I don't find HS to smell bad, but I definitely can tell you that patients feel as if it smells bad. And to them, it's a huge deterrent, right? So if you feel like you're constantly in pain, constantly dirty and smell bad, you don't want to be with anybody. So this is the time where you're supposed to, meet people and maybe start a relationship. That is a killer. So you can't get a job, can't get education, can't get, your personal life. I mean, you can see how that can affect your quality of life, which is a fancy term we put on. We say, oh, quality of life. It really makes you feel like crap every day. And at some point, it takes a toll on a person. And there's no antidepressant that can do this. So you, the skincare provider, dermatologist, a naturopathic doctor, a Chinese medicine practitioner, whoever you are out there, you, by making a difference in HS, can save a life. And so that's kind of in a nutshell how the disease presents and how it affects you. And yeah, it's devastating, but I got to say the reward is enormous because when I see a patient that comes back and we start them on some treatment and we've done a couple of things and within a few weeks they're back on their feet and they're back to function, I got to tell you, there's no better reward as a doctor to see this. So, you work hard, but the reward is 10 times bigger.
Yeah, Hadar, I mean, when it comes to HS, you talk about even integrative medicine, integrative approach. You've got a condition that you try to hide, soaks through your clothes. So now you can only wear dark clothes. And for some people, that pus builds up for such a long time that they're not moving. They get overgrowth of candida. So now you smell. And so now it's like you're worried about people judging you when they see you. You're also worried about them judging you when you try to put your clothes on like you normally should. If you get too hot, you start sweating. That creates a bit more inflammation and maceration in those areas. And then some people, when you do get that, I agree with you, usually it doesn't smell, but if you get this overgrowth of yeast, which can happen because you tend to also gain weight, because now you're so darn depressed and so painful, you can't even move and exercise. Now you've got like the smell component. I mean, talk about debilitating you on every single level. And I think that this is where like integrative medicine really matters. And, the other part I tell people, you cure a disease, you don't cure the psychological damage except by being a cheerleader with them. And I think that's really important to let them know that it's okay to express their sexual frustrations or if they have any sort of social frustrations with you too, because I think that's part of the disease. It's part of like even getting things approved by the insurance company if we need to push things. So how do you treat this condition?
Yeah, so like I alluded to before, and I don't want people to think that, oh my God, this is so depressing. It's a disease that has its severity, but the great news is that nowadays we have a lot of different treatments. And as I mentioned before, nothing is a silver bullet, but when you combine all the modalities we have, then you're starting to really make an impact. And by all modalities, let's break it down. And, it's kind of a bit of a synthetic breakdown that I'll do. In real life, you kind of, everything affects everything, right? If you treat the inflammation, you help the pain. If you help the pain, you help the quality of life. But let's separate it a little bit. So there's what I call kind of the way I think about treatment, right? So there's the medical therapy, and there I'm going to target, the inflammation, if there's some overgrowth of bacteria, maybe the hormones that play a role, right? So there's that medical therapy part. And then there's the adjunct therapy, what you alluded to, right? Talk about your feelings and the psychological support, the wound care that is enormously important. We just published data showing that just by giving patients with HS a good dressing, you can improve their quality of life maybe as much as adalimumab, believe it or not, just by giving them good wound care. So certainly wound care.
It just speaks to the severity of these wounds, right, Hadar? Like these
Exactly.
wounds
Yeah.
are a big deal.
Yeah. And then the other part of this is surgical. So, there's certain procedures that you can do that really give a lot of times definitive treatment, or the closest thing to a definitive treatment that we can get. So with all this combination, we really, really make an impact. And so, I like to tell patients that it's a marathon and we'll add component as much as they're prepared to and get there. But for example, a lot of patients, the hormonal part is really driving this, and using something like spironolactone has been a really effective medication. I know you, for years, has run the spironolactone session, so I need to tell you about spironolactone, but maybe you can tell us, because on this, you definitely are the expert, how to use spironolactone as a medication in HS.
Well, the challenge with HS is that we only have, thank goodness we even have one FDA-approved treatment right now. There's many that are promising on the horizon, so we'll see, what emerges in the next couple of years. Thank goodness that we have a ton of research in the area. But yeah, so, when we see an HS patient, you're left with really working through what can you use off-label. And really the approach used to center on, well, let's treat it like it's acne of the armpits or acne of the groin. But it doesn't work that way. These acne medications that we try don't always work. But one that does is spironolactone. And spironolactone is an aldosterone analog. And I think it's a hormonal blocker in a way, a reducer. It blocks this DHT, which is dihydrotestosterone, from activating its receptors, and also blocks the conversion of testosterone to DHT. Traditionally, the FDA approval was for blood pressure,
Right.
so for hypertension. But nobody uses it for that. Really,
Exactly.
the vast
Yeah.
majority of the cases, it's used for things like hair loss, where you need to block that DHT activity, and also in acne and HS. And so typically the dosing we have to get up to is 100 plus per day. I will push the dose up to 200,
Right.
250 for certain
Yep.
people. And you have to watch out for certain side effects. You have to pick it in the right person. You have to, make sure they don't have an allergy to classes of medications. That'd be an issue. Very important. Also, if you're going up higher in the lower doses, they've shown that in young, healthy people, you don't have to check potassium, but we're going at higher doses here, and it's a potassium sparing diuretic. So you have to watch their potassium levels. So you do need to ask about nutrition. We can come back to that. You also have to just realize that there's going to be some shifts in hormonal sensitive tissue. So guess what? Can't use this in men, or else you're going to grow them boobs. And that's usually not a
Yes.
great secondary side effect.
I can't tell you how many times I sit in clinic in front of a guy, and in my head I'm thinking, man, I wish I can give you spironolactone, because it really, in combination with other therapies, is good. But yeah, I agree totally. Yeah, you got to watch for these. And I tell patients, basically, it's going to block your sex hormones. So you got to be aware that this is kind of the hormonal stuff is going to play a role. So maybe
so you can get a little bit of vaginal spotting in between.
it's like an extra bleeding between periods, right? Yeah.
Exactly. And then a little bit of breast tenderness.
But I want to just stress that as effective as it is, it's in combination with other things. And so
And it is being used off label, right, Hadar? Just want to make that comment. So you want to be sure you're seeing someone or working with someone that has knowledge in this area. But again, it's not the only medication, because there are some other things that I've used and, again, off label, but nutrition becomes a big component of this conversation.
Yes. So let's talk about that, because I think it's a topic that patients really want to know about. I'll start with, by the end of this, is that the data, as in many things in nutrition and dermatology, is not at the level of a randomized controlled trial. Not yet, at least. We want to get there, but there's a few things that we can share and try to see. I'll tell you what I do in my practice for this. So, for example, there is a blood test you can do to look at the immune response to a yeast called Saccharomyces cerevisiae. Now, this yeast is actually pretty common, and that association was kind of noted actually more in inflammatory bowel disease, for example. But turns out that in people who develop this immune response, they develop immunoglobulins against this, then changing, modifying their diet can actually make a difference. And, you know, anecdotally in my practice, I test for this rather routinely. And anecdotally, I can tell you that maybe, one in every 10 patients or so will have this kind of elevated immune response to it. And I coach them on this and I say, look, you got to watch for, baked goods, things like pizza, things that rise, basically the good stuff, and beer, for example, right? If you watch for these, then maybe that can try to improve symptoms. And so I'd say that in patients that I find that elevation and they are actually adhering to this kind of diet, they've noticed a difference. And I want to put a proportion on it, right? Because it's never in isolation. It's one building block in the regimen. And so anecdotally, patients who've done that told me that they've noticed a difference. So I think it's something to explore in your practice, and at least in my hands, have been useful.
Yeah, and I think when you talk about nutrition, the big bad elephant in the room sometimes is weight. And
Yes.
one of the things that we know is that, and I think it's really important to make this recognition, not every HS patient is overweight. And also, many
Absolutely
HS
not. Yeah.
patients are overweight. And so when we talk about nutrition, it's not like a covert way of talking about weight necessarily. Nutrition actually can make an impact even if you don't have a weight issue. And the reason for that is a lot of the foods that we eat right now are very high insulin stimulatory ingredients. In fact, Robert Lustig did a podcast with us earlier and talked
Yes.
about this. Remember that, Hadar? And it was a beautiful
Absolutely.
podcast. So if any of you want to go back and just learn a little bit more about all these hidden things that are in the foods that can stimulate that insulin spike, go back and listen to that podcast because it's highly relevant here.
Absolutely. And it's not surprising that there is overlap in metabolic syndrome and HS. We see
Exactly.
that people with HS have a higher prevalence of metabolic syndrome compared to the general population. But your point about obesity is really important because I can tell you that, yes, a lot of my patients with HS are obese, but a lot of them are not. And same goes for smoking, by the way, right? So smoking is another lifestyle kind of thing that we talk about with HS. And the data clearly shows if you are a smoker and you have HS, you're kind of part of that big group. So if we look at people who have HS, more of them tend to be smokers compared to the general population. But it's not to say that if you pick up a cigarette, you're going to get HS. And it's not to say that
Yeah.
if you're a non-smoker, you can't have HS. But there is that kind of high association. And I got to tell you, when it comes to smoking cigarettes, it's actually a quite easy recommendation to make because we know the benefit of not smoking, right? So that's an easy recommendation to make. Both of these recommendations, by the way, are not something I'll pop up in the first visit. So that's kind of a clinical tip, right? People come in, if you just think about it, you're an HS patient, right? The literature will tell us that the delay to diagnosis is about 7 years, right? So for the past 7 years, you've been walking around emergency rooms, primary care doctor, GYN, all of them told you, oh, it's nothing. Oh, you're dirty. You need to clean yourself. Oh, all this stuff. And now you're going to walk into a dermatologist that is your hope for cure, and he's going to tell you that you need to lose weight. I think that's not a good starter. So it's not to say that it's not important, but again, that concept of a marathon, I'll bring it up in the second or third visit when they feel a little better about themselves. Because remember, and that brings me to another topic I want to bring up. You're going to ask people to lose weight, but they feel like crap. We just talked about it. So really, so now
I
I
mean,
can't
it
even,
hurts to move, Hadar.
yeah,
You can't even
exactly,
exercise.
exactly.
And it
So
becomes and I think this is where nutrition is a great starting point because there are certain foods we can have them eliminate. So for example, I have them eliminate anything that's a real high mTOR like stimulating food. And there are several studies that have looked at, what are those? Like things that are high in leucine, meats. By the way, your collagen supplements can be really high in leucine too. So check that as well. Because sometimes when you take a lot of collagen supplements, you can break out with acne. So you want to try to
yes,
reduce that. Another one, dairy. Like, just there's so many alternatives. There's no reason to stay on dairy at this point. And they all taste great too, but don't eat dairy that's non-dairy that's full of sugar either. So really bring down that glycemic index. And then food pairings, which will be a topic in future podcasts. How do you pair your foods so that you can lower the glycemic index of something that you're eating anyway? And I'm sure, Hadar, you and I are going to be at the edge of our seat for a podcast like that, where we can talk
Oh
about how do
yeah.
you pair foods and bring it down. But I can give you one small example that was done. People were eating white bread and they looked at the glucose spike that they got. And over time, they ate more and more almonds along with the white bread. And what they found was, in a dose response, as you ate more almonds, that glucose spike started to come down. In fact, it turns out if you eat avocado toast in the morning, just having the fats from the avocado will blunt the glucose spike again. So there's all these little tricks that you can use.
Yeah, and it's not surprising. We probably developed to do that over the years of evolution. And I remember meeting one of my ancestors, and they said avocado toast, you know. They were, I guess, born in California all that time, and I
Well,
didn't
hey,
know.
olive oil blunts that response too. Did you know
Yeah,
that? That's pretty
exactly.
cool. That's why you
Exactly.
do bread dipping in olive oil. It
Yeah.
blunts it. Now, it doesn't mean that you eat a ton of bread with olive oil that you're good to go, but it's just like, it's like,
Yeah, right. No, it's absolutely true. And I think kind of quantity control is something, at least in the US, that we need to kind of train our brains around. You know, when you go to a restaurant, I mean, the plate sizes are enormous. And if you travel outside of the US, I think you'll know what I'm talking about, because you can see that. Or if you grew up outside of the US like I did, you know, we definitely do. Our serving size is enormous. I want to talk maybe towards the end here about the issue of exercise that you kind of brought up, because to me, I think it's a huge gap in evidence that we have right now when it comes to
yeah.
HS. Because as you mentioned, if you're overweight, one of the good ways to reduce the weight or redistribute your weight is to turn fat into muscle, and that, or to lose fat. And one of the ways to do this is with exercise. And there's two kind of, the way I think about it is two major ways of exercise. One is kind of cardiovascular, where you just kind of, getting your heartbeat up there and try to quote unquote burn calories. But there's also another type of exercise that we tend to leave out a lot, and that's the kind of core strength, kind of building your muscles that are already there. Because I like it because you take your muscle and you make it, twice as big, and that in return can actually burn more fat locally, because now you have this metabolically active tissue, namely a muscle that really needs to burn energy. But the challenge with HS here is, how do you do this? If you have, a huge boil kind of in the groin there, and you're trying, how are you going to do squats? How are you going to go for a run? Every little thing is a challenge. And while we don't have the definitive answer in a form of a trial or data, what I try to guide patients about is to try to do things that you can. So, for example, if your disease is below the belt, then you can do things with your arms. So, leverage that. What do I mean by that? You can even do cardiovascular. There's like, I don't know what they're called, but they're like hand bikes, Or if you feel like you're overweight and it hurts your joints, to go jogging, you can even get into a pool if you have access to that and do sort of
I think that's a
cardiovascular
great suggestion.
exercise in
Yeah.
the pool, right?
Offload.
Yeah, exactly. Offload the weight. So there's so many different things, but unfortunately, a lot of times we don't get to do it in a short visit. And this is where our colleagues around medicine can really help. And hopefully in the future, we'll be able to also pair personal trainers and people who are more versed in exercise to help us develop these regimens.
Well, Hadar, I think to kind of wrap up, the last little bit that I wanted to mention, because you're right, I mean, such great suggestions on exercise, is also, what about these subvariants that you see that might give you a clue to a bigger diagnosis? And what do I mean? If you see someone with HS and they have a bit of alopecia, or they have acanthosis nigricans, this waxy, slightly hyperpigmented, velvety kind of skin in the folds, like whether it's the neck or the axilla, and then it raises this whole notion of insulin resistance and maybe other things going on. It's been shown that if you have HS and you have some of these other skin findings, you really have to start thinking about polycystic ovarian syndrome, which then opens up a whole host of other metabolic derangements that are possible. And now you're talking about, cardiovascular health and perhaps lipid health, and kind of touching back to what you're saying, which is that HS isn't just about the skin and then the mind. It's also about the body internally. And we don't want to miss these things. And I think when you're a practitioner that's seeing these patients for something that's so devastating, getting that extra clue in there looking at their skin, looking at their hair, and making sure you can give them that extra look and not miss a diagnosis can make such a big difference in getting them on
Yes.
the path towards the right therapy.
Absolutely. And a little practical pearl there. We mentioned the HS Foundation website. If you go there, one of the publications you'll find is a recent effort by the foundation, led by the genius Amit Garg in New York, to develop a set of recommendations about screening for people with HS. And that means that, we know there's a lot of associations with other conditions. You mentioned PCOS, metabolic syndrome, we mentioned inflammatory bowel disease, the list goes on. The question is, what are you going to do in clinic, right? So you're like, let's say you're a dermatologist, right? You have like a 10, 15-minute visit. How are you going to cover all this? So this kind of paper gives you a very, very good understanding of what to do and when. And there's a table that's very clear. And a lot of this stuff is easy. Just take a look, right? So look for acanthosis nigricans, for example. It's a physical exam. You do this anyways. So now you kind of put a little checkbox. And so that paper is available, I believe, on the HS Foundation website. And you can take a look at the table. It's very easy to do. And a lot of this end up, being referring out, but it's stuff you already see. The data is in front of you. All you got to do is take quick action. And you can definitely improve your patient's life and outcomes more holistically. So thank you for putting a plug into that. Absolutely.
Well, Hadar, I think we did it, my friend.
Yes, absolutely. So I want to say that in the upcoming Integrative Dermatology Symposium, we're going to talk about HS quite a bit. So definitely check that out.
You're doing a session on wound care.
Yes, absolutely. We're going to do wound care, which is going to be broad application of wound care and dermatology in general, but also it'll be some focus on HS there as well. And we have the HS series live on LearnSkin.com, and that is a tour de force of all the experts in the US really, really hammering out the disease and every aspect of it. So don't forget to check that out. All right. Hey, Raja, do you know where the integrative medicine movement started?
According to Google, since Google knows everything, Dr. Andrew Weil founded the Center for Integrative Medicine at the University of Arizona in Tucson back in 1994. Why do you ask?
Well, you know how we always try to get to the root cause? I think we need to go big for the fifth annual Integrative Dermatology Symposium. How about we do this? Let's meet at the Los Ventana Canyon Resort in Tucson, Arizona. Or you can join virtually from September 30th to October 2nd and hear from the world-renowned experts like Andrew Weil.
Exciting. And our theme is connecting mind, body, and spirit to take a more holistic approach to our patient care. What do you say?
Absolutely. I mean, where else can you get the latest on diet and dermatology, hypnosis, botanicals, common diseases, aesthetics, and other unique topics in dermatology with practical takeaways to start using in clinic right away?
So true. And let's not forget, we've got the new track for estheticians too. I think I'm going to need to call in a sick day or two before the symposium so I can enjoy the waterfall and trails on the resort, stargaze, play a round or two of golf or tennis, relax at the spa, and catch up with colleagues at the evening receptions.
Yes, that place is spectacular. Use our discount code POD25 at checkout for 25% off.